Welcome back to DBC. We're on number 7, and we're continuing today with solution-focused brief therapy. Today we're going to talk about chapters 2 and 3, which are kind of similar, so I want to cover them together. And today you're going to see many examples from last time we talked about miracle questions, difference questions, relationship questions, and scaling questions. Keep an eye out for those today because they're definitely involved in individual and group sessions. So chapter 2, the individual session roadmap. First thing we want to establish is what is the client's goal? What needs to happen in order for this session, let's say, an individual session, to be useful? And there might be a bit of, we can call it reluctance at the beginning about like, oh, nothing needs to happen, I don't want to do this. But kind of dig around because a lot of times as this book was developed, there were people who were court mandated to attend sessions, so they didn't really want to be there. They may not have consciously even acknowledged the goal. So to kind of dig around, oh, nothing, I don't want to do this. Oh, okay, well, who had sent you here? Why did they send you here? Oh, so what would you like to have happen? I want them to get off my back. Awesome, there's a goal, get off the back. So step 2 then is to verify that that you understand the client's goal, that the client's goal is what, so that we're on the same page and reading the same book. And you can do that by asking about what differences would be, and then scaling questions as well. So once we've agreed on where we're going, the question is, we ask the miracle question. So what would it be like? We covered this in the last video. A miracle happens and you're at year 10 already. What differences would you notice, and what would let you know that this miracle had happened? And then another thing is like what I just did, look for changes in their body language. So they might lean in or adjust themselves in their seat, or they might look up to either direction to sort of imagine. That means that they're imagining the victory, and we want to get them as vivid as possible. What's that actually like for you? What differences do you notice when you first wake up? So the miracle question, listen for exceptions and details. Now we want to ask a scaling question, okay? That's a vivid, detailed picture of where you're going. Where are you in the progress to get there? And a really cool reframe that they do here is that if someone says a 4, we might initially think, oh, 4 to 10, man, that's like an F- in school. But a 4 is actually, hey, you're almost halfway there. That's great news. So what have you done? Next step, what have you done to arrive and maintain at a 4 out of 10. Awesome, cool. And so we're always reinforcing what they're doing is positive. So the next one is the relational question. So this is like, where would your spouse rank you, or your child, or even your boss, if that's appropriate? And if maybe they're still struggling, we can even do, and they mention this explicitly, it's cool because this is all in the hypothetical. Where would your pet, if your pet could talk, because people are a lot of times very close with their pets, right? If your cat could talk, how would your cat rank you on this? Or an infant, if they had the ability to speak at this point, how would they rate you? And then again, if there's that gap there, what don't they know yet about you that is responsible for that gap? Awesome. So what would they say? And because we all want to look at behaviors too. So what would those people say, your cat or your infant or your dog or your boss, what would they say? What behaviors what are you doing that get you there? So we're looking for specific behaviors here. This is the key. Specific behaviors from someone else's point of view. That's the key. And then what difference are these behaviors making? So after all that, that'll be most of the session. And then we want to ask, we're always looking forward in solution-focused brief therapy. So where would you like, or where do you think you could be by our next session? And what will be different then? Awesome. So again, get details, differences. How confident from 1 to 10 are you in your ability to sustain these changes? And talk about that with them. And then the last step of the individual session is to invite them to self-assign homework. And a big key here is to not prescribe them, here's 2 things you need to do by next time, or 3 things you should do by next time. But this needs to be coming from them, what they think they should do, and what differences that will make in them to get them to, let's say, from a 4 to a 5. So 2 rules about the homework are that they will explain what differences it will make to them, and then that they know that if it's not working at any point, even before the next session, like they can stop and try something else and be creative if they want. And then finally, at the end of chapter 2, there's a cool sort of image given of sort of the spirit behind this, of what we want to, how to proceed through these steps, because it can be a bit mechanical and be, okay, do this, check, 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 check. But the idea is to walk beside them in their personal journey. So we're beside them in their personal journey to discover a place in a world where their problem doesn't exist and is in the past. Really cool. So chapter 3 goes through a very similar process, except for it's in solution-focused groups, which, according to the authors of the book, they use more often than individual sessions. A quick note or three notes about the therapist's role in a group setting with solution-focused groups. Three roles of the therapist. Number 1 is to maintain a safe environment, ask questions to assist the clients to identify how their life's going to be once their miracle has happened and their problems are behind them. And number 3, to empower them to take the steps to make that happen. All right, so if it's a group session, let's assume that everybody doesn't know each other. The first thing we're going to do is ask a future-oriented question and then invite everyone to introduce themselves by their name and answer the question. So the question might be something like, what is a characteristic that you don't have yet that you'd love to have in the future that will help you in your life? So they'll go around and introduce themselves and ask this question. And what's going to happen is clients are going to bring up their pressing issues that have whatever's been bothering them most recently. And that's not what we don't want in the group session is an individual session with 10 uninterested observers. So what do we do when the client brings up their acute problems that are going on with them most recently? We acknowledge them and we remain focused. Okay, sorry to hear that, or thank you for sharing that, and boom, move on to the next one. So as people are doing this, the therapist, this is like a tough part of the job, is you're listening for common themes. And we want to sort of intertwine all of those into a broad, all-inclusive theme. Ask yourself, what are my clients telling me today? What's going on in their lives? And the idea is that then you want to reflect what they've all said. And I like the idea of making eye contact with them as we talk about what they've said so they know that you're listening to them specifically. It's very powerful. And then the image here is if you ever like threaded a needle, you know that thread is actually a bunch of little threads together to make a piece of yarn or a string. And so we want to sort of twist those up and to thread the needle so that everybody gets through and we don't lose any off to the sides. So after we reflect and summarize and establish a theme, we want to ask permission to address this theme. And so that'll be kind of the topic of the day. And then we ask the miracle question. Let's say before this, everybody said like, oh, you know, my grandma died this week and I'm really struggling with dealing with that. My son was taken away from me because I'm not going to my AA classes that the court wanted me to go to. Or my house is being foreclosed and we're going to have to move out and I don't know where we're going to live. I have no family around, right? So we want to take those things that seem like they're totally different things going on and what do they have in common? These are roadblocks in our clients' paths of their lives or roadblocks or stumbling points on the road. And we want to ask the miracle question again would be, well, what would happen if this was all in the past? Or could you imagine yourself in a year, 3 years, 5 years from now, where this is all behind you and you got through it great and you're even stronger because of it now? What's that like? Boom. So again, we're listening for details and even for clues that the miracle is already in place because the idea being that our clients have their own resources already within them, their own solutions. What's already there if they're telling you anything about that? Next question, again, so this is again paralleling the individual session. All right, we've got the number 10. So from 0 or 1 to 10, how would you assess yourself at this point? And then what have you done to reach this number? I'm going through this kind of fast, but what would your significant others, pets, infants, what would they say if there's a gap? What don't they know about you yet? And then how is this conversation or this process helping you to get to a 10? And also when you're asking a lot of these questions, look for other people nodding when someone else is talking, because that means something is going on or that they're sharing the same struggle or the same insight, and bring them in so that we're sort of keeping these strings all wrapped up nicely together. Again, just like as an individual session, we will invite them to assign homework and a summary of the session, and the big key here is the therapist leaves the room when that's happening. Leave the room, walk outside. And then again, the therapist returns and can listen to some of the homework. And then there's this idea of compliments again, is that we're framing it as feedback because the authors feel that sometimes if you say a compliment to somebody, they assume that you have a criticism in your head that you're not sharing with them. So we frame it as feedback, and the best feedback is about things that the clients are doing outside of the session. So actions that they're taking, and again, use their own words, not your words, as much as possible. That way, there's no objection because it's like they said it, and these are things that they're doing, and they're being complimented, even though we're calling it feedback. And there was one last comment about using a co-therapist in a group, because there's going to be so many words going on. It helps to have an extra set of ears going on. And yeah, so that's it for this time. Next time, we're going to dig even further into the miracle question and discover around there about some more details of how to get more detail on how to use the miracle question more effectively. Thanks, guys.